Howdy, folks. Dr. Ben here from Nashville. You're listening to the Dr. Ben and Friends podcast. We're dedicated to putting the med in comedy. See what I did there? We're shining a big, bright light on healthcare heroes and heroes of comedy. We're here in Nashville, where the chicken is spicy and the comedy is even hotter, thanks to comedians like Marcus Saputo here. He's a hilarious, charismatic Italian comedy with humor for the whole family. Marcus, thank you for being here.
Thank you so much, Doctor. I'm pumped to be here, dude.
Awesome. So glad you're here. I'm Dr. Ben, your host. I'm a board-certified orthopedic surgeon by day and stand-up comedian by night. I replace knees and shoulders during the day, and I replace silence with thunderous applause and deafening laughter at night. Getting a little hard of hearing from all that thunderous applause and deafening laughter at my shows. We have a real-life healthcare rock star with us today, Dr. Jennifer. Dr. Jennifer, thanks for being here.
Hey, thank you so much for having me.
Now, Dr. Jennifer is a board-certified hospitalist, folks. She practices in Nashville. If you're admitted to the hospital, Dr. Jennifer may take excellent care of you, and we're going to find out exactly what a hospitalist is in this episode. So you're listening to Dr. Ben and Friends podcast. We prescribe 100% comedy with zero copay. We're celebrating those healthcare heroes and comics who dedicate themselves to making the world a healthier and funnier place to live. All right, buckle up, folks. If you're a doctor, nurse, tech, patient, or just anyone that likes to laugh, we're here for a good time, whether you're scrubbing in, punching out. Thank you for joining us. A special thanks to our sponsor, The Needles Group in beautiful Marco Island, Florida. As a doctor, I know a great needle when I see one, and these realtors are the best in the business. Buying or selling, let The Needles Group inject some serious value into your property game. TheNeedlesGroup.com. Have you ever been admitted to a hospital, Marcus?
Oh, yeah. All the time.
Eating too many meatball subs?
Yes, they say my my sodium levels from the lasagna I eat is off the charts. So I got to do blood work every week. They told me to quit eating so much sauce. But yeah, I have. But I have no idea what the people do or what. I just tell them, I'm like, look, you just got to fix it. Whatever is broke. That's not my specialty.
Dr. Jennifer, what would happen if someone had too much sodium intake from too much spicy meatballs or sauce? What kind of medical conditions could that cause?
Yeah, so high sodium levels certainly can be an issue. You have to take those seriously. They can cause sleepiness, potentially seizures if too high, comas, that sort of thing.
Better watch out, Marcus.
Yeah.
I've been struggling with sleepiness lately for the last 12 years of my life.
Might be why.
So is it because of my baked ziti I eat every night?
The baked ziti.
Yeah, it sounds delicious, but maybe.
Now, what about cheese? Is overconsumption of cheese pizza an issue?
So not with sodium, but certainly it can cause bowel issues.
Yeah.
if you eat too much of it.
Like constipation, or in my case, I'm lactose intolerant. So,
Yeah.
Oh, Dr. Ben,
Yeah.
God bless you. I'm sorry.
so it's actually, listener, Diarrhea Awareness Week. runs through Friday. So, no. Poop jokes aren't on the top of my list, but they are a solid number 2.
Yes.
They are. But listener, if you consume too much sodium, it can lead to high blood pressure. And if you have heart failure, it can
make that worse.
put
Yeah,
you
makes
into
you retain
congestive
fluid.
heart failure. So
Yeah.
hopefully you don't have that.
Well, to be frank, I haven't been to the doctor in years. I don't even go because, I'm a believer in exercise and diet. So usually I'm pretty.
Okay.
I'm also 30 years old. So that could have something to do with it.
Yeah.
I think this is the only reason Marcus wanted to come on the show, right? You agreed to because there was a doctor and you were trying to get free healthcare advice.
Literally, that's all I'm here for. I have
Could we
no
get his blood
insurance.
pressure?
Are you kidding me? I'm a comedian. That means no insurance and no money to pay anybody. So,
All right. We'll take your blood pressure and check your blood sugar after
yeah,
this.
I'm waiting for it.
All right. Dr. Jennifer, I don't mean to put you on the spot. Can you remember any memorable patient story without violating patient confidentiality that whether it's something that kind of sticks out or kind of reaffirms your decision to go into hospital medicine, or something you can remember that just kind of made you feel good. And this is why I do this.
Yeah, there's a couple stories. I'll share probably the most recent. I had a gentleman that I admitted over a year ago who had come in with some lung issues, and the outpatient story didn't make sense. He'd been treated for pneumonia multiple times, wasn't getting better. And so I got a CT scan, and he ended up having bilateral, basically pus. It's called empyema in both lungs. So he had to undergo surgery and was in the hospital for some time. Young gentleman. And he was just so grateful that we had taken care of him. And just last week, actually, he contacted the hospital and came down to visit me and let me know how well he was doing. He brought me flowers.
You saved his life.
Yeah, it was very, very humbling because I was doing my job, but for him, it was everything. And that's the part that I like about hospital medicine is usually I get to see patients come in sometimes at their worst, but I usually get to see them go home at their best or better. And so that's why I love hospital medicine.
Did we ever find out how he got pus in his lungs, or sometimes we don't know?
We don't know. He was otherwise healthy. So it was an odd presentation, but I just knew something about it was
Not
different.
diabetic.
Nope.
That's mesothelioma, okay? I had that, all right?
Marcus does construction also.
I do construction, so
Asbestos doesn't scare him.
asbestos is, we're best friends.
He puts it on his pizza.
Yeah, and I call the 1-800 number every week to get my compensation.
Class action lawsuit.
Yes. That's also why I'm here, so.
I love it.
Yeah.
I meant to ask you too, how does one become a hospitalist? Is that do you need like a GED, or how does that, what training is involved to become a hospitalist?
Yeah, so you have to have an undergraduate degree, go through medical school, and then residency. And typically hospitalists are usually either internal medicine or family practice. I personally am internal medicine. It was a 3-year residency. They do have, I think, a fellowship in hospitalist medicine. I don't have that because it's essentially this, internal medicine can do hospitalist. So I did not go through the fellowship to do hospitalist.
I think of have you ever seen House MD or Scrubs? Like Dr. Cox on Scrubs, I think of, those would be hospitalists, kind of trying to diagnose and treat.
Wait, so you're telling me back in the day, your primary used to go to the hospital?
Right.
And be like,
Yes.
hey, I'm here to take care of you also.
Yes.
But I'll see you back
In the
at
office.
Yes.
office.
Yes.
See, I didn't know that.
Yeah, and in fact, in my residency, that's how it was. The primary care doctors there had an office that was connected to the hospital, and they would come over and round in the morning with me. I was there rounding on their patients. They would round with me, then go back to their office. I'd manage the patients all day. Right. Then they would come back in the evening for any new admissions, that sort of thing. But it's a really long day for them.
Yeah.
Right.
So what happened? So you're not an ER doctor though, right?
No.
So
Correct.
they fix it, kind of,
Stabilize
and then
them.
send it to you.
Yeah, so they
Right.
stabilize, and if they can discharge the patient home, great.
Yeah.
But if it's something that can't be fixed at home and they have them stable enough that they can be moved on, then that's when we take over and we admit those patients to the hospital to do further testing or further treatment to get them better.
Yeah.
Yeah.
Okay. Now, if I ever go to the hospital, I'm going to tell the ER doctor, send me to the hospitalist. And they're going to get so offended.
Right.
They're going to be like, for what? I say, you're not qualified. I'm sorry. I know a hospitalist, all right?
And we're going to have some ER docs on here too. We'll
Good.
hear
Yeah.
their side of the story.
Yes.
Yeah.
Yes.
I love it. Dr. Jennifer, what role is technology playing in the hospitalist medicine? And then kind of where were we and where are we now and where are we headed with like AI? And is it, are you in danger of losing your job for a AI robot? Or
I don't think so.
Okay.
I think that, from when I started, we still did paper charting when I was in residency, which was a lot. I would come home with cramps in my hand every day. And so now most everything is on the computer with typing and that sort of thing. But I think that AI is going to play a major role in helping with some of that. We already have an application that we use currently that kind of captures the conversation with a patient, and then it transcribes that into my note and makes it so much easier. It saves me so much time so that I have less time documenting and more time with the patients. So I'm excited to see where that goes in the future too.
Right. Like it listens like ambient conversation, then it transcribes it. Because right now the medical records, it's kind of the bane of our existence. We have to dictate all the conversation and everything. So
and or top it up. And
what about for like diagnosis and treatment? Do you think, as far as technology and AI, and everyone's already putting their symptoms into like Dr. Google, and then convincing themselves they have cancer?
Yeah. I mean, I think there's a lot of helpful information out there, but I think that information is more helpful for those that can interpret it a bit better. So I don't see that AI is going to replace the human part of that. I mean, you can spit out symptoms all day long and give a whole list of things it could be, but until you have someone qualified to do that, I don't think that AI is going to be able to do that.
What about like telehealth? Could you ever work remotely, do you think, just from home?
Me personally, I don't think I would enjoy it. I like the personal interaction. And I have dogs at home, so I would be much more distracted by them at home than I would doing that. But yeah, I think it plays certainly a vital role. My family members have had telehealth visits, when they've needed and have gotten them taken care of. But me personally, I enjoy the human interaction.
I think you're a dog person too, right, Marcus?
Yeah, I got a dog. His name's Vinny.
Vinny.
He's a French bulldog.
Oh,
He's got a medical condition. He's got many, okay?
Yeah.
He's got
What's wrong with him?
IVDD, where whatever, like the nerve in his spine. I mean, these dogs aren't supposed to be an item. Like, they're not normal. So then, he struggles walking. So I'll send him to your hospitalist. I'll send him to you.
We'll see if they have a vet hospitalist somewhere.
Yeah.
Yeah.
No, I want him in the actual hospital.
In ours.
Right.
Yeah.
A human hospital.
Yes.
Do you have health insurance for your dog?
No.
I guess there's like pet insurance.
No, there is. Yeah. I was just like,
crazy.
whatever.
Yeah.
We should have went into veterinary medicine.
You should have.
Yes.
Yeah.
Pet owners just come in with bags of cash and say, here, fix my dog.
No, literally. They wouldn't. Their arm could be dangling off, and they're like, I'll do it next week. If it's their dog, they'll be like, fix it now. 10
exactly.
grand.
Here's $10,000.
Yeah.
Fix it now.
Yeah.
Yeah. I always say I feel like dogs are very expensive. I don't have children myself, but I think they probably rival some pediatrician bills as well.
Oh,
my
yeah.
gosh. Yeah.
Yeah.
I love it. All right. Well, your job's probably very stressful. How do you kind of, Dr. Jennifer, unwind or cope with those long shifts and kind of the grumpy orthopedic surgeons and specialists you have to deal with day in and day out?
Yeah, so I try to just disconnect myself from work when I can. I sometimes can't do that, but I browse social media. I love sports. Watch football, watch hockey. We go to the Preds games here a lot. The Titans, if they were good, we may possibly go, but
so you don't go.
Yeah.
Awesome. And Marcus, you're a sports guy too, right?
Yeah,
Or
somewhat.
Somewhat.
I watch baseball and I watch boxing a lot.
boxing.
'Cause I box and stuff. So
Okay.
I'm more into fights and stuff like that.
Okay. I'm trying to be like Jake Paul of comedy and kind of circumvent the traditional.
Yes.
For my comedy, I just want to circumvent,
Same.
20 years of open mics and
Yeah.
just start getting
That's how you
Yes.
do it. I mean,
go around.
just skip everything else.
Yeah.
Did you grow up a Tennessee Volunteer fan?
I did. I grew up, Maryville's about 20 minutes from Knoxville. So I used to go to the University of Tennessee games all the time, football.
Awesome. Go Vols. Can you teach us Rocky Top here before?
Oh, I could, but you don't want to hear it from me.
You know the song.
Okay.
Okay. Well, Jennifer,
No.
you have to.
Oh, that's hilarious.
We won't put her on the spot, but
Yeah,
maybe
thank
another
you.
another
I'll
episode.
put you on the spot.
Something about.
I heard you got some nicknames, Jennifer.
Yeah, I probably do.
I heard they call you the house doc, captain of the floor guy, the admit machine. Does that sound
Yes.
right?
That
And
sounds
the
right.
rounding rock star. What do these names mean to you?
So all of them seem very accurate, very accurate, all combined into one. Because we admit from the ER all day long. We're rounding on the floors. We, kind of manage the care. We have lots of consultants that help us do the things that are outside of our wheelhouse, but we certainly still try to bring that back to the patient and say, hey, I talked to so-and-so, just so that we can try to, summarize the care and make it better. So I think those nicknames are all very valid.
That's it.
Yeah.
They call Marcus sometimes the house doc. 'cause
Yeah,
he's
they call
construct-
that's what
Yeah.
they call me, but
Okay.
it's
The
when
house
their
doc.
sink is leaking. So
call the house doc.
yeah, call the house doc.
My-
Yeah.
They got a hole in the drywall. I can fix it.
Call the
but
house doc.
Yeah,
Yeah.
if your nose is runny,
Don't call.
good luck.
Yeah.
How come like your nose runs but your feet smell? Isn't that backwards or kind of
That's
kind of
true.
ironic
Yeah,
that your nose runs but your feet smell?
Yes.
think it
Oxymoron.
is.
That's right, oxymoron.
Yes.
And then Dr. Jennifer, like for Marcus or the listener that comes in, and a lot of times the patient doesn't know like what to ask or what kind of advice would you give to the kind of Joe Public listener when they're at the hospital? Like what should we be asking the doctor as far as diagnosis, treatment?
Yeah, I mean, I think the more you ask, the better. I think the more that you are involved in your care, the better you'll understand it and hopefully prevent it in the future. So I always encourage patients to ask about, what is this test going to show you? When do I get to go home? What are you waiting on for me to go home? And those are things I try to update every day. You know, the plan for the day, what we plan to do today, when I plan to get you home. But I think just be an advocate for yourself and your family members is the best that you can possibly do.
Mm-hmm. And listener, don't be afraid to ask. If you have questions, let's get them answered. And
Yes.
the doctor comes by at least once a day, but you can always get in touch with the nurse who will get in touch with the doctor. And if you have any questions, and then there's a whole team like case managers that help with discharge plans, and it takes a village.
It does. And we're, the hospitalists are typically in the hospital for those 12 hours. So we're always available, even if not able to come to the room, certainly, like you said, via the nurse or, case management visits those patients as well. It really does take a village.
Mm-hmm. And then now the hospitalists too, are they the ones that if someone codes, like code blue, they're the ones that have to go to that, right?
We do. We respond to all the codes in the hospital, and typically like the ICU teams, a lot of times will show up to those and help. The ED sometimes will show up to help as well. But yeah, any code at all, whether it's a code blue or a code stroke or what we call a rapid response, which is one of those conditions where it's not quite a code blue, but could lead that way. They'll call those. We respond to all of those in the hospital.
Hold on. What's
Yeah.
the code? Is code
That's
blue? It's like this person's turning into a blueberry, or like, what's the issue?
Yeah, what is code blue,
Yeah.
Dr.
Yeah,
Jennifer?
so code blue is when the heart has stopped and the patient is not
Oh,
breathing.
that's
and so
way worse.
Yes,
Yeah,
yes,
wait.
yes. Would much
But
rather
you
have
would
a blue,
turn blue,
blueberry.
probably.
Yeah, I mean, you probably would. Okay.
Yeah, but that's when compressions and CPR and that sort
Right.
of thing would be initiated.
Okay.
Yeah.
Yeah.
Yeah, so if you're in the hospital, hopefully that's not ever the case, but if your heart were to stop beating or you stop breathing,
Yeah.
there's a button on the wall, I think, right? that
There is.
the
There's a
nurse
button
pushes.
that a nurse or a tech can hit, and it calls the code overhead so that everybody knows to respond to that.
Code
Yeah.
blue. Major problem.
Code blue.
Major problem.
And there's also a code brown, but I don't know if we want to talk about that. That's something else. Clean
I
up
can
and
see that.
aisle.
Yeah.
Yes.
That's a good one.
Yeah.
The American Heart Association said that for chest compressions, there are different songs that you're supposed to do for the tempo, like "Staying Alive," "Staying Alive."
Yeah.
Are there any songs that that you think of in your head when you're doing the chest compressions?
No, that's the one that sticks out in my head because just about every time I have done my recertification for that is the song that they play. And so in my head all the time, that's constantly what I'm singing when I'm doing compressions.
Could I request a song? Like if I'm about to get
Yeah, I want something with more
compressions?
tempo.
I mean, realistically,
Yeah,
I probably wouldn't be able to say anything at that point. But
What
could I
song
be
would
like,
you
yo,
request?
Michael Jackson, Thriller, or Billie
Thriller.
Jean or something? Yeah.
Yeah.
I think
It's
it
pretty
would work
upbeat. Those
better
would work.
on my body.
Yeah.
Is what.
Yeah.
Put that on.
I would just have a note
tattoo it.
on my driver's license. Say, make sure you do Billie Jean compressions, on
compressions.
me.
That's
yes.
right. That's right.
Organ donor and Billie
Billie
Jean.
Jean.
Yeah.
I like it.
One of the songs, though, American Heart Association said that you can do chest compressions to is "Not Like Us" by Kendrick Lamar. They not like us. They not like us. 101 beats per minute. So they said that one is acceptable.
Yeah.
But I found out that while it is a good tempo for performing the chest compressions, it's not a good tempo when you're running to someone that needs the chest compressions. I'm always like, Mustard on the beat, bro.
That's
Man
right.
down, calling. It takes me 10 minutes to get to the code.
That's right. You got to stay with the beat.
Grab the crash card. I'll be there in 10 minutes.
Yeah.
Mustard on the beat, bro. Man down, calling Amber Lips. Tell him breathe, bro.
I think they
Takes me
should play
forever.
that. If so, if it's a cold blue and
Overhead.
over the whole hospital,
Should hear the song.
Everybody should hear that. It might be more uplifting, you know.
That's right.
The person
Yeah.
might wake up because they're like, "Yo, this is lit right now. Like I can't be dying for this."
Yeah, they should just
a great
play that song.
suggestion.
Yeah.
And then everyone would know to go call a room number. And
That's
then,
right.
So
And dance their way down there.
that or staying alive or
Yeah.
Yeah, staying alive.
we'll just
Yeah.
play different songs and it'll be
Yeah.
different codes to go to the
Yeah.
room. All right, knock knock howdy folks, Dr. Ben here, ready for dad jokes delivered. Now those one-liner, eye-rolling groaners, that's actually how I started stand-up comedy, believe it or not. I was just going around the hospital telling one-liner dad jokes, and next thing you know, I'm doing stand-up comedy. So we want to celebrate those dad jokes. We want to hear from you, listener. What is your favorite dad joke? And if you record yourself delivering the dad joke, we may even air it on the Dr. Ben and Friends podcast, or we could have a professional comedian read your joke, and you could tell us about the comedian's timing and delivery of your joke. So we're celebrating those dad jokes, and we have the very hilarious, funny comedian Marcus Saputo here to get us started with a dad joke.
All right, here we go. Today, our dad joke delivered is from Ted in Michigan. What do you call a fake noodle? Anybody got it? Listener?
Fake noodle.
Fake noodle. I would say a fugazi noodle. And you call him impasta guy. Okay.
Impasta, I like it.
I feel targeted a little bit, Dr. Ben, on this show. They're like, oh, Marcus is coming on. Let's bring out the noodle joke.
It was just random selection.
Yeah, I don't think, 'cause this was totally random.
My wife, actually, I told her that I could make a car made out of spaghetti, and she said, no way. But you should have seen her look when I drove pasta in my spaghetti car. Yeah, I just drove pasta.
You drove pasta.
But yeah, we celebrate those dad jokes. Last night I was trying to read the entire dictionary in bed, and I didn't finish. I got up to pee. So I wasn't able to finish.
Yeah.
But,
Yeah.
I actually memorized 6 pages out of the dictionary. I learned next to nothing. I always thought cesarean started with an S, but when I looked it up, it was in the C section. Cesarean.
Yeah.
Okay. So keep those jokes coming. We celebrate them, and we don't roll our eyes. We laugh at them. So, listener, we want to hear your favorite dad joke. All right, Dr. Jenner, any advice you'd give to the listener as far as maybe preventative medicine or staying out of the hospital from being admitted and seeing someone like you? Like an ounce of prevention sometimes is worth a pound of cure.
Absolutely. I think there's a lot of things. I mean, I think take your medicines like you're supposed to. Unfortunately, that happens a lot where patients don't, and then they end up in the hospital. Obviously, smoking is one of those big things that affects the heart. It affects risk for stroke, all of those things. So certainly I'm a strong proponent of smoking cessation. And then just be an advocate for yourself. If something seems off, go get it checked out. Don't wait. Because usually the earlier those things can be found, the better.
And health maintenance too. Have a primary care physician and see them regularly.
Absolutely, yeah.
A lot of
Even-
times they come in and they haven't seen a doctor for
Yeah.
30 years.
Yeah.
And
And
then
I hear
by
that
then
a
it's
lot.
like my blood sugars are 800 and
Yeah, I hear that a lot where I have never had any issues, but you don't know if you don't have issues if you don't get checked out. So I would definitely agree, even if it's just yearly. And then certainly if the primary care doctor feels like there's something more that needs to be monitored closer, they would let you know that every 3 months, every 6 months, whatever that would be. It certainly helps.
Dr. Jennifer, do you enjoy comedy at all?
I do.
Stand-up comedy or comedians or?
I do.
All right. Do you have any favorites that you, aside from Marcus Saputo and Dr. Ben?
Yeah, I mean, you guys obviously are at the top. I think Kevin Hart is probably one of my favorites
Hilarious.
to watch. Yeah, he's a funny guy. And I like Dwayne Johnson as well. I know he's not a comedian, but the two of them together is pretty comedic. Yeah.
The Rock. Love it. Now, do you have any questions for a professional comedian or two that you kind of see comedy on TV and they make it look easy? And
Yeah.
any questions like behind the scenes? What's
I
it
do.
like?
I wonder just how did you get into comedy? Did you just wake up one day and think, man, this is what I want to do? And like, how did that work out?
You go ahead, Doc.
Marcus?
You want me to go? Okay. Yeah,
I'm still not sure I want to.
Well, yeah, I think I'm going to retire after this podcast. It kind of just, I was doing, because like I'm a business guy. So like I've been like self-employed doing business my whole life. And then I was living in Salt Lake City and I moved back to Oklahoma where I had some family. And I got rid of this other business I was doing. I was like, I just want to do something I enjoy. I've always been a huge fan of comedy. I never thought I'd be a comedian. It wasn't like a childhood goal or anything. I wasn't like, yeah, let me do this, And then I moved back and I was like, let me try. So then my first open mic was at the Looney Bin Comedy Club in Tulsa. And it was cool because like they would do open mics on Wednesday nights before the actual show. So it was like a real audience, like whatever.
How many minutes did you do? Like 4?
5. Yeah,
Okay.
5 minutes. And it actually went well my first time. Because, I've always had like sarcasm, I've always been funny, but like not. Like people, there's a difference. It's like, oh, my friend's so funny. Like they could do stand up.
Right.
I'm like, no, it's not the same. Like,
But it's very different.
But if you are funny in person, like usually you could write jokes and whatever and do it. So yeah. And then after that,
How scared were you? Do you remember?
I was terrified. I was shaking like a dog. And for those who haven't been on stage, like depending on stages, is until you're like more veteran, the lights are blinding. So like people, when you get up there, all you just see is nothing. And then you're like telling.
And it's silent.
Yeah, and
Jokes
it's
to
just
the lights.
silent and people are waiting and you're like, oh, this is awful.
Yeah.
And so we had a real comedy, it's different at different venues, but like at an actual comedy club, like the lights are really bright. So like until you get used to them, you don't see the crowd. You just go up and like blindly tell jokes.
Did the 5 minutes go by quickly or did it seem like 10 or 15? Like, do you
I
remember?
think it went by pretty quick. Yeah.
Okay.
I was like,
You had a nice
before
tight
I
5 minutes set.
Yeah.
Did you have a lot of laughs at the first
I
one?
actually did.
Good.
Yeah, which I had like some people like not good experience. Mine was good.
Good.
And
Do you remember what it was about at first?
Yeah, I had a bit about like Italians throwing lamps. Like was part
Is that
of
common?
it. Yeah, because
Okay.
we're angry, Dr. Ben. The lamp is the easiest
Okay.
thing to throw. No, I had a bit about it was about
Is that
Italians.
considering throwing shade? When you throw shade on someone? It's-
Yeah, that's
Yes.
what that's how we throw shade.
That's how
it's
Italians
literal
throw shade.
shade.
It's literally
Yes, yeah. You'd be like, you throwing shade? I'm like, not yet, buddy. Just wait. I got a Pottery Barn lamp just waiting for your head.
throw some shade.
Yeah.
Yeah.
But no, it was that. I was comparing Italians throwing lamps, or that they could throw a lamp further than they can throw a football. And then I forgot what else, but yeah, it was pretty,
Awesome.
it went good. So then after that, I was like, all right, this is cool. This is fun. And then,
Are there any stand-up comedians to whom you look up to as far as...
oh yeah, so many. Bill Burr is probably one of my favorite. And it's funny because like I'm a clean comedian, but like I like dirty comedian. I don't like raunchy comedians, but like I admire everybody's. In the contrary to like other comedians, like they don't watch people's specials. I watch like a ton of specials because it's like nothing at the end of the day is like that original. You know what I mean?
Mm-hmm.
So there's certain aspects every comedian has learned from somebody else and incorporated in their act. You know what I mean? So it's like
Smart.
that's with any art form. Like nothing is. So
Everyone always asks me, do you know Dr. Ken? Because we're both
Oh,
doctors
really?
and
Yeah.
Asian. So
Yeah.
do you know Sebastian Maniscalco?
yeah, that's the
Okay, you
thing.
guys are-
Everybody thinks I'm Sebastian. I'm like, oh, maybe there's just like we're both Italians and like our cultures act the same, like cultures usually do. And so yeah, everybody's like, oh, you like. I'm like, no, really, like.
Sebastian, if you'd like to open for Marcus,
Yeah,
send
if
us
you'd
a
like to-
tight 5 minute
Yeah.
set and
Yes.
we'll take a look.
Go ahead and send me an email. I'll review it. Yeah.
I love it. But yeah, that's terrifying. Have you ever tried You probably have to give presentations sometimes.
So I do, and I have never enjoyed public speaking.
Okay.
Sitting around a table, I'm great, but getting up, like you said, with the lights, I would be blinded and just probably stand there and freeze and run off.
Are you nervous and scared just doing the medical presentations and talks in front of people? Or?
Sometimes, yeah, just being the center of everyone's attention, just a little unnerving. Obviously, if it's something I know more about, then I feel a bit better with it. But comedy, there's no way I could do it. I commend both of you. I love comedy, but I the whole time I'm watching, I'm like, I would be a nervous wreck. There's no way I could do it.
Marcus and I could maybe write some jokes for your next presentation to kind of break the ice.
Yeah, that make them more interesting.
The best mesothelial
There we go.
joke you've ever heard.
I'll email you so you can review it next time. Yeah, yeah.
What's the deal with mesothelioma? What's the deal with lung cancer?
Yeah. House from the 1940s. Got tough breathing. Could be mesothelioma.
That's right.
And Dr. Jennifer could probably help us with maybe some pharmaceuticals to keep us calm for our anxiety before performing.
That's right.
Yeah, that would be helpful. Actually, I get excited now.
Okay.
After a while, I get more
I bet you
excited.
get used to it.
Yeah, you get used to it, and it's so fun. Or for me, anyway.
Kind of adrenaline rush.
Yeah.
Yeah, like and so now I get nervous, but more like excited. It's where before it was just straight nerves. Like you need some, what's it called, propanol.
Propranolol.
Yeah, that. I can say that word. Whatever, dude.
No, I'm impressed you know that.
Yeah.
Yeah.
That was good.
Beta blocker, it kind of slows your heart rate and your...
Yes. Yeah.
So...
Yeah.
But yeah, it used to be very terrifying. And so it's less terrifying each time now. But I remember the first couple of times, it's like, why am I doing this? I'm never doing this again. And I thought I was literally having a panic attack. I could feel the palpitations. And,
Yeah.
Yeah.
But you get more comfortable.
Yeah.
But anything else you can think of to ask a comedian? We kind of...
Yeah. So how do you come up with your jokes and the things that you're going to talk about? Because there's such a smooth transition, I find, when I'm watching comedians. They just kind of transition from one topic to the other just seamlessly. But I'm sure it takes a lot of work.
Yeah.
Yeah, do you have any inspiration?
Yeah, well, I write. It's interesting. So many comedians do it different. So, like, guys have notebooks and like write word for word. Is where I don't write anything down ever. Like, I'll write like the premise down, but then I know the whole joke. And then usually I don't sit down. I'm like, let me write a joke. It's like when I'm driving, I'm like, oh, this is an idea. Or like, I went to Costco the other day, and like, now I'm writing a whole bit on Costco just because I was like, it's just observational. Like I notice everything about people or like situations. So then I just like think of that and then start writing something from that. And then once you have a premise too, like I take old jokes that are a good joke, but then I'll either change it or like add another 5 minutes to it that you weren't thinking about, that you're like, oh, this would also be, how can I extend this joke and make it even funnier?
Yeah.
Yeah.
It's kind of an art too, because sometimes maybe you can speak to this, but you'll do a bit and you don't know if is it the crowd, is it my timing, is it the delivery, is it the content? How long do I keep tweaking it and trying to, when do I just abandon it or?
Yeah. Yeah. That's what, and not that I'm like super experienced, but I've had a good amount of stage time for the amount I've been doing it. To where now I know somewhat when a joke is going to land. And then so it's just like developing that more or changing a word or timing. A lot of it is getting rid of stuff like words. Like you'll get up there and you'll say so many words and you're like, I don't need get to the funny is what you do basically. Yeah. So, but I never, in terms of writing, like I just think of whatever. I do Dr. Ben's podcast, and I'm going to write a whole bit about that.
That's
you know,
right. Yeah. What a joke!
What a joke this is. Yeah, I'm going to come up with 10 minutes about orthopedic surgeons and hospitalists.
There we go.
Yeah.
Oh, that'll have them rolling in the aisles.
Yes.
That's right.
So, and I kind of do observational stuff to where I'll put a note in my phone, then kind of revisit and write some jokes, and sometimes it's just glaringly obvious. Like I was at a Chinese buffet and was mistaken for an employee when someone came up, a customer came up and asked if there's more General's chicken coming out. So I'm like, I got to write a joke about that.
Yeah.
Or
What did you tell them when they asked? Did you say, "Yeah, it'll be out soon"?
I just smiled and bowed and
Yeah.
oh, I go to LA for cat. Then more General's chicken. No, it's too polite to correct them. Or a employee at the hospital asked if I'd buy some Girl Scout cookies from her daughter, and so she sent me a link. And as soon as I clicked on the link to order it, the Girl Scout website asked me, "Do you accept cookies?" So I'm like, I got to write a joke about that. Like, so I had to write a joke about just stuff like
everywhere.
Exactly. Or you'll see like headlines, a lot of funny headlines, like the Winter Olympics, the Norwegian ski jumping scandal, where they're enhancing their suit in a certain area to get along. I'm like, I got to write a joke about that. And I see a lot of funny medical headlines that a lot of times I incorporate.
Yeah.
They're just bizarre. Like we have a segment coming up with bizarre headlines that my email is just flooded with all these, like, is this really real? And sure enough, it's just bizarre medical headlines. Like,
it's funny.
Whether it's they transplanted a pig kidney into someone, which really they did.
Oh, man.
Or someone performed surgery with a Swiss Army knife. And so it's just all these bizarre things like, this can't be real. And it really is. So I'm like, I got to talk about that and put the med in comedy.
Yeah.
So, well, good. All right. Anything else you can think of for either of you? You have any medical questions? Free medical advice here?
Is there ever someone who comes in, and well, they might go to the ER first, but you do all this stuff and they're like, "I'm not fine," and you're like, "You're fine," and they're like, "No, I'm not," and then they're just there mowing around for like a week, like they're like totally fine, but they're just like, Do you ever have that or no?
So there are some times where patients don't need to be admitted, that they could be managed at home, and sometimes that takes a little finesse.
Yeah.
Most of the time we don't admit those patients because there's not really a good billable reason. And so we just tell them, if you get worse, obviously come back and see us. But there are times we've admitted patients to do further workup and found nothing either. And some things you can't find all the time. There's not a test for every single ailment that's out there. So you just do your best in working through that.
Okay.
Yeah.
That's all.
All right. Do you have any ailments or anything you'd like some advice on?
I got there's a lot going in my head all the time, So that whatever ailment that is, I got it.
I have the same ailment.
No, I'm healthy. I've always been big in exercise and whatever, and so as I've aged, even though I'm young still, I've noticed, and I'm in a trade, so like I use my body physically. Even hitting 30, I'm like, this stuff ain't working like 19. You know, like I get,
wake up with aches and pains.
And, like I gotta wring my neck out and warm up before we, go to Dr. Ben's podcast.
Do calisthenics.
Yeah.
Before swinging that hammer.
Yeah. Besides that, healthy.
Do you use a lot of power tools?
Yeah.
In construction, or are you still manual?
No,
like nail guns and
the loudest power tools I can get. That's what I'm getting.
Oh, really?
Yeah.
The louder, the better.
Yeah, just to annoy. I want to go deaf, and then I want to annoy the neighbors as much as possible. So, yeah.
I use a lot of power tools too.
Yeah, I know.
So we could.
That's what the thing. You guys got like DeWalt drills and stuff in there. You're drilling in people's arms.
Yeah,
I really
saws.
Yeah, I would like to see like what I'm like. What you just go to the Home Depot and they're like, yeah, this is qualified for orthopedic surgeon. You got a DeWalt multi-tool. You're cutting someone's wrist open.
Yeah, I actually fell in love with my power saw, but unfortunately, it didn't reciprocate.
It wasn't reciprocal.
No,
Yeah.
Yes, one of the reps was trying to sell me on this. He said, this power tool, it has a bit, it spins really fast and makes a hole in the bone. I'm like, yeah, I know the drill.
Yeah.
I know the drill.
You know the
drill. Well, folks, we got to pay some bills here, so time for an ad read. All right, thanks, team. Now it's time for some common sense healthcare ads. This episode of the Dr. Ben and Friends podcast is brought to you by Posture Perfect Potion. Drink up and stand tall like a giraffe on stilts. Correct slouching in seconds. Warning, overuse may lead to bumping your head on door frames. Enter code Dr. Ben at checkout for 25% off your first purchase of Posture Perfect Potion. Do you guys have good posture? Do you sit up Nice and
horrible
tall.
posture.
You see this action I got right here? I'm already just, I'm looking for scoliosis is what I'm looking for.
Right. There's probably some chiropractors listening to the podcast, but at first I was a little skeptical about chiropractors, but I went to see one and now I stand corrected.
There you go.
See?
Yeah, I stand corrected on the chiropractors. So, all right, folks. All right, we're scrubbed out here now. Listener, thank you for joining the Dr. Ben and Friends podcast live from the heart of Nashville. And remember, we can be serious in surgery, but some of us are seriously funny. We're celebrating healthcare heroes and comics. So be sure to hit that subscribe button on YouTube, Spotify, Apple, Amazon, wherever you get your podcast, listener. And your word of mouth is our best support. So tell a friend, colleague, family member, tell your doctor, your nurse, tell the house doc. We have 2 house docs with us today.
Right.
So we'd love to hear from you. Send us your jokes, your comments. Marcus, you're a national treasure here. Where can listeners find you, Marcus Saputo?
Look me up, Marcus Saputo, at everything on Instagram, YouTube, all that. I got a dry bar special that just came out, and then I'm have another special that I self-produced that will be coming out in a few months. So check it out.
Check it out, listener. Thank you for being here, Marcus. Dr. Jennifer, thanks for being here. I don't know if you want listeners to actually see you or find you. If you're taking care of them, I'm sure they'll be in great hands, but it's not necessarily something listeners will want to come see you.
Out. Yeah, but no, if you're admitted and I'm there, Dr. Jennifer, please let me know you heard the podcast, and it's been great being on the podcast. Thank you. And great meeting you, Marcus, as well.
Yeah, you too.
Yeah.
All right. Thank you both for being here. Dr. Jennifer, Marcus Saputo, Dr. Ben and Friends, putting the med in comedy. All right. Take care, y'all. Thank you.
Dr. Ben.